All right, let's talk about your urinary system. Your urinary system, the overview, the function of the urinary system is to remove waste products from the body, remove and manage fluid volume, electrolyte balances, and assist in maintaining a normal blood pressure. So there's like really complex ways that your urinary system is involved with this. We'll talk about some of it, just kind of a general overview. The filtration process starts at the liver. The liver will break down waste products from cellular metabolism, from food we eat, from toxins we ingest, things like ammonia, nitrogen, excess electrolytes, things that we don't need that are possibly caustic or damaging to the body will be filtered out through the broken down by the liver and transported to the kidneys via the bloodstream. You have a renal artery and a renal vein. So the artery is carrying blood to the kidneys, and inside the kidneys, you will go through a process of filtration. So products that aren't needed, that are possibly toxic, or like electrolytes we have an excess of that we don't need, will be filtered out inside the kidneys and expelled in the urine. Things that we do need or can reuse will be reabsorbed into the circulation, and via the renal vein will be put back into the circulation to be used in the body. In the filtration process, the urine will collect in the renal pelvis, and it'll sit inside the renal pelvis until there's enough to be filtered down the ureters into the bladder. On this slide here, you'll see an image of urine flow through the urinary system. First off, the kidneys, like we were talking about, these two bean shaped organs on either side of your abdomen, the left and right side. This is where filtration of the blood starts, and the making of urine starts. So urine is formed here. It's collected in the renal pelvis, and then it, via gravity, will travel down the ureters. You have a left and right ureter into the bladder. The bladder is this sac. We can hold a lot of urine in the sac. There are muscles, there are sensory organs, sensory tissues that tell us when the bladder is full. And then when we're ready, we can relax the bladder, dilate the sphincter in the bladder, and the urine will come out of the urethra. Travel. That's the last tube that'll travel down through your genitalia. So women have a lot shorter urethra. Men's urethra is longer because it has to travel through the penis and then outside of the body via the urinary meatus. The meatus is the opening of the last part of the urethra, and that's where the urine leaves the body. Let me go over these terms and definitions here of organs and anatomic structures of the urinary system. So the kidney is one of two bean-shaped organs located on each side of the vertebral column on the posterior wall of the abdominal cavity. So they're in the back of your abdomen on the left and right side of the vertebral column or your spine, and they're on the flanks, so the sides, each side of your body. The nephron is a urine producing microscopic structure, approximately 1 million nephrons in each kidney. These are the functional units of the kidney. This is what does the filtering. Glomerulus. The glomerulus is a cluster of capillaries at the entrance of the nephron. The process of filtering the blood, thereby forming the urine, begins here. That's where it starts. The renal pelvis is a funnel shaped reservoir in the kidneys that collects the urine. So that's where urine starts to collect before it's passed down the ureters. A hilum is the indentation of the medial side of the kidney, where the renal artery and vein and renal pelvis are located, and the ureter leaves the kidneys. So that's kind of where the traffic is going in and out of the kidney. The ureters, two slender tubes, approximately 10 to 13 inches long, that receive the urine from the kidneys and carry it down to the bladder. And then the urinary bladder is a muscular hollow organ that temporarily holds the urine. It fills, the thick muscular wall becomes thinner, and the organ increases in size. We can hold a lot of urine in our bladder, typically about 3 to 500. You're going to have a sensation where you need to urinate. But there are certain circumstances where there can be a lot more urine held in that. So it's very malleable and stretchy. Urethra, the lowest part of the urinary tract through which urine passes from the bladder to the outside of the body. And then the urinary meatus is the opening through which the urine passes to the outside. So that's the last part where urine passes through. Here are some combining forms from chapter 6. There are a lot more that I'm leaving out, so I suggest you read the chapter and study and practice and use the exercises. But here are some of them. Albumino is referring to albumin, which is protein. Azoto is referring to urea or nitrogen. Glycoso is sugar. Hemo, blood. Hydro, water. Litho, stones. Nocti is night. This is an interesting one because the combining vowel is an I instead of the typical O. Oligo, scanty or few. Uro, urino, both referring to urine or the urinary tract. Some of the prefixes you will need to know. Prefix of a or an is absence of or without. Dis is painful, abnormal, difficult, or labored. Poly means many or much. Trans, through, across, or beyond. And some suffixes you will see in this chapter. Seal, suffix seal means hernia or protrusion. Ectomy, excision or surgical removal. Emia, in the blood. Gram, record or radiographic image. Iasis, condition of. Itis, inflammation. Lith, stone. Disease and disorder terms, built from word parts, not built from word parts. These are just a few. There are a lot more in the chapter. Cystolith. Cystolith is a stone in the bladder. Nephrolith, a stone in the kidney. So a kidney stone and a bladder stone. Pyelonephritis, inflammation of the renal pelvis and the kidney. Nephromegaly, enlargement of the kidney. Acute kidney injury is an abrupt decline in kidney function, hours to days. Usually this is reversible. There are some cause that we can treat and the kidneys will get better. End-stage renal disease is a condition in which the kidneys no longer function on their own. This is not reversible. They will need dialysis or a kidney transplant to survive. Urinary retention, abnormal accumulation of urine in the bladder because of an inability to urinate. And hypospadias is a birth defect in which the opening of the urethra or the urinary meatus is not in the typical location. So the opening, the urinary meatus, is in a different location than the normal condition. This can be men or women, more often seen in men. And some surgical terms, built from word parts, not built from word parts. Cystostomy. Cystostomy is a creation of an artificial opening into the bladder. So for some reason they can't urinate, their urethra is damaged, you need an artificial opening into the bladder to relieve the urine. Nephrectomy, excision of the kidney or removal of the kidney. Nephrolithotripsy is surgical crushing of stones in the kidneys. So they're crushing kidney stones in order for you to be able to pass them. So a renal transplant is a surgical implantation of a donor kidney. So somebody who has end-stage renal disease can get donated a kidney from a living family member or somebody who has a matching blood type. Extracorporeal, shockwave lithotripsy, so non-invasive surgical procedure to crush kidney stones. So they don't do surgery, it's from outside of the body. They use shock waves to crush or fragment these stones in order to pass them. And hemodialysis. Hemodialysis is a modality used when the kidneys are failing in stage renal disease, in which your blood is hooked up to a machine that filters the amount of water, electrolytes, waste products from your body and returns the amount needed. This is in order to do the function of the kidneys through a machine to keep you alive. Diagnostic terms built from word parts. Here's a few off of the list. Cystoscope is an instrument used to visually examine the bladder. Nephrosonography is a renal ultrasound. Renogram is a radiographic record of the kidney, an imaging test used to evaluate kidney function, renogram. And some not built from word part terms. Blood urea nitrogen is a blood test that measures the amount of nitrogen in the blood that comes from urea. An increased BUN detects an abnormality in renal function. Creatinine, a blood test that measures the amount of waste product in the blood that comes from the normal wear and tear of muscles. An elevated amount may indicate impaired kidney function. Your kidneys are supposed to be excreting this BUN, or blood urea nitrogen, and creatinine. So when the levels rise, this may indicate that the kidneys aren't functioning as well as they should be. Specific gravity is a test that's performed on urine to measure the amount of concentration of the urine. So diluting abilities of the kidney. If your kidneys are very concentrated or diluted, this can be kidney dysfunction. Complementary terms. All of these terms on this slide here involve the suffix urea, which means urine or urination. Anuria is without, so not urinating at all. Dysuria is painful or difficult to urinating. Glycosuria is sugar in the urine. Hematuria is blood in the urine. Nocturia is urinating at night. Oliguria is few or scanty, right? So urinating less than normal. Polyuria is urinating more than normal, a more than normal amount. And pyuria is pus in the urine. These are some more complementary terms not built from word parts. So a diuretic is an agent that promotes the formation and excretion of urine. This can be a drug, or it can be something simple like caffeine, like coffee is a diuretic. Peritoneal dialysis is a procedure for removing toxic wastes when the kidney is unable to do so. This uses the peritoneal cavity, or the abdominal cavity, is used as a receptacle for the fluid used in dialysis. They instill a bunch of fluid into your abdominal cavity, which soaks up waste products not needed, electrolytes, and then that fluid is removed and it pulls the waste products out with it. So it's a form of renal replacement therapy, kind of like hemodialysis. A stricture is an abnormal narrowing, such as a urethral stricture, which is a narrowing of the urethra. It makes it difficult to urinate. Urinary incontinence is the inability to control the bladder, causing leakage of the urine. And the last slide of the day, abbreviations: AKI, acute kidney injury; ARF, acute renal failure; CKD, chronic kidney disease; ESRD, end-stage renal disease; PKD, polycystic kidney disease; BUN, blood urea nitrogen; UA, urinalysis; HD, hemodialysis. These are just some of the common abbreviations related to the urinary system. There are a lot more. I suggest you guys work through this chapter, do your exercises, your quizzes. It's pretty interesting stuff, but it is a lot to go over. So make sure you get started, get working on this soon.